Calming Clinic. I'm Dr. CalmingEscape. I'll be leading your exam today. Okay, just have a couple questions for you. It looks as if you are in just for a basic checkup. Is that correct? Good. Good. When was your last checkup? Was it at this clinic or a different one? Okay. So, I'm just going to need you to confirm your name for me, first and last. Your date of birth. Good. Okay. Alright, so before we dive into your full exam, I did want to ask you, today at the clinic, we are helping to get some training hours in for some med students. They are working under me with some of my patients. So, because you were just doing a general checkup, I just wanted to see if you would be alright with 2 of those students coming in and helping with your exam today. Yes, I will be overseeing all of it. Okay, that's alright. Good. Yes. This program is very beneficial and gets them some great training hours, so we really do appreciate. Of course, thank you very much. Yeah, it's a program that the clinic's been working with for a while, just to help get some more training and real-life experience with doctors like myself, working to assist them. And it's a program that's all over the country as well as the world, really. Yes. We have one student that I believe is from the south somewhere, I'm not entirely sure where, and then we also have someone that's from England. Alright, so looks like that is all taken care of. So if you have any sort of questions or comments, concerns throughout today's appointment, you just let me know. I'm going to be in the room with them the whole time, just working to observe them. Yes, I promise. They are very good. It takes quite a bit to apply for this program and to be accepted, so have no fear. Okay, good. Now, are there any concerns that you have besides just the normal checkup? Is there anything that's been bothering you, anything of that nature? Okay. Alright, so we will go ahead and get that exam started. Alright, let's do this. Hello, lovely to meet you. I'm one of the students that is going to be working with Dr. CalmingEscape today. How are you? So, to start off this checkup, I'm going to be using this stethoscope here and just having a listen to your heart, as well as getting your pulse and things of that nature. Alright? Perfect. If you have any questions or comments for me, please don't hesitate. Alright, so I'm just going to put the stethoscope along your chest to listen to your heartbeat, and I'm also going to be feeling your wrist to begin with for that pulse point, and then I will also feel along your neck for that pulse. Alright? Wonderful. So, I'm just going to place it on your heart. Just try and relax. Yes. You can close your eyes if you like, whatever makes you the most comfortable. Okay. Good. Good. Any sort of heart problems in your family? Good. Good. And I assume that you have not had any sort of heart attack or open heart surgery, anything like that? Lovely. Good. Your heart sounds nice and healthy, and your pulse is a nice steady rhythm. Yes. Good pulse point. Alright. Could you hold your breath for me just for... and breathe. Lovely. Now I'm just going to feel your neck here. Still listening to your heart. Good. Lovely, lovely. Perfect. So, sounds nice and healthy for you. Do you have any sort of concerns regarding your heart? No. Good. Wonderful. You're not taking any sort of prescription medication that, right, would be related to your heart or any heart conditions? I didn't think so. You sound really healthy, so wonderful. So next up, I think we're going to go ahead and listen to your lungs next. So I will pass off the torch, if you will. All right. Well, hello there. It's awfully nice to meet you. Yes, we greatly appreciate you allowing us students to help perform this exam. Yes, it's very kind of you. Alright, so I'm going to be looking at your lungs to start. Just going to listen to how your breathing sounds in my little stethoscope here. Of course, if you have any questions for me, don't hesitate to ask. Do you have any sort of problems with your lungs that we should know about? Wonderful. So, it's going to be real easy for you. I just need you to breathe nice and normal for me, and I'm going to have a listen to your lungs from a couple different places on your chest. Of course, so I'm just going to move it around, and I'll also listen to your back as well. And then a little later, I'm going to have you take some nice deep breaths as well, even some shallow breaths. Alright, perfect. So let's go ahead. Just going to place this. Let me warm it a little for you. Alright, I'm just going to place this on your chest. And like I said, you just breathe nice and normal for me. Alright. Do you notice any cold bothering you at all, or allergies, anything that would disrupt your breathing at all? Alright. Sounds nice and good. Nice and normal. Of course. Right. Alright, now I'm just going to reach around behind you. Once again, you just go ahead and breathe nice and normal, nice and easy for me while I listen to your lungs. Pretty easy test. Good. Good. And from this side as well for me. Just breathe nice and normal. Of course, you can sit back and relax. Okay. Alright. So, offhand, your lungs sound nice and healthy. Don't hear any sort of wheezing or anything that we need to be concerned about. So now I really need you to take some nice deep breaths, okay? So fully fill up those lungs for me. Hold it. And out. Understand? Good. Alright, so nice deep breath for me. And out. Again, a nice deep breath. Fill up those lungs. Out. Good. Good. Okay, another nice deep breath. In. Hold it there. And breathe out. Alright. One more before I listen to your back again. So nice deep breath. Hold it. And then out. Alright, good. Now I'm going to do the same thing, just this one place right here on your back for this side. Take that nice deep breath again. Good, alright. Good. Do one more on this side. So, again, nice deep breath. Good. So now if you can, if it doesn't make you feel a little lightheaded or anything, I want you to breathe a little quicker if you can. Do you think you can do that? Alright, we won't do it for very long. Just keep with that quickness. It's going to move the stethoscope around your chest again. You can take a break if you need to. Alright, and along your back, just keep with that quick breath real quick. Alright, and one more on this side, that quick breath. Perfect. And then just breathe normal for me again as I listen once more after that quickness there. Alright, wonderful. So, your lungs sound nice and healthy. I don't think there's anything that you need to worry about. Alright. So I think we're going to go ahead and check your face next. I'm not going to perform that one. So let's just go ahead and swap on out. So for my next portion of your exam, I'm going to be doing a little bit of face examination, palpation. Alright, so I'm just going to put on some gloves for you. Do you have any discomfort along your face or your facial features? Right. Any skin conditions that we should be aware of? Just having a look at your face, noting the symmetry within your features. No one's face is completely symmetrical, but it's good to have a look and kind of compare each side to make sure that nothing is drooping or anything of that nature. Alright. Good. So I'm just going to be touching your face if that's alright. Gentle touches, I promise, but just some palpations to make sure that your face is the right texture, temperature even. And I don't feel any sort of bumps or lesions, anything like that. Yes, you can close your eyes if you like, or you can keep them open. It's entirely up to you. Whatever you are most comfortable with. Okay. Just from the top of your forehead down the sides of your face into your chin and your neck. Good. Okay, wonderful. And just a little bit onto this side. Bit of a tapping motion, if you will. And the same on this side, just a little bit of tapping with my fingers to kind of get a feel for your face. Don't feel anything. Looks nice and symmetric. Right. Good. Any sort of sinus pressure along your nose, under your eyes, even up into your forehead. Okay. Good. Alright. No, that's fine. Yeah. You can close your eyes if you like. So, now I'm just going to go ahead and test whether you can feel my touch on both sides of your face. Alright, so if you were to close your eyes, can you feel that I'm touching you on both sides? Wonderful. And what side am I touching you on now? And now? Alright, again. Okay. Now how about if you could pinpoint exactly where on your face I am touching you? I'm just going to take my finger and poke you. Exactly. You can tell me where exactly I poke you at. Your nose, wonderful. Eyebrow. Temple. Your chin, wonderful. Forehead. And what about, can you feel 2 points at the same time? So, say I touch here and here. Good, forehead and cheek. And does that pressure feel the same to you? It does, good. And what about here and here? Same pressure on your temples there? Lovely. And what if I pressed here and here? Yes, along your lips. Does the pressure along your lips feel the same? No sort of discomfort around your mouth or anything? No. Good. Alright, so I do have just this pin. Don't worry, it's not open. And I'm just going to kind of touch your skin just real lightly as kind of a dull point for along your face and your neck. If you could just tell me whenever you feel this. Go ahead and touch a little poke of your hand. Do you feel that? Same thing, just let me know when you feel it across your face. Good. Right. Lovely. Good. And you can feel the difference between my hand here with the glove or the pen, right? You can feel the texture difference, of course. Right, lovely. So that is your face examination done. Palpation and sharp dull, everything. Alright, perfect. Wonderful. Go ahead and move on to the next portion of this examination for you. Alright, so hello again. Now I'm going to be taking care of your eyes. Do you wear any glasses or contact lenses? Alright. Do you find that bright lights bother you, or even have trouble seeing in really dark places? Okay. Any sort of trouble driving at night? Just some standard questions for you. And have you had like an eye infection or anything like that in the past year? Good. Alright, so I'm just going to use this light here. I'm going to use it with this little attachment to kind of fully see into your eyes. And then I'm also going to have you track the light, read an eye chart, just to do a standard little eye test. We are a regular clinic here, but we like to do and make sure that your eyes are nice and healthy, and if we notice anything, we can pass you along to a eye clinic. Alright, so I'm just going to have you look right straight ahead at me. You can look at my nose if you like, and I'm just going to look in your eyes. Alright, so you just hold still. Feel free to blink whenever you need to. Yeah, I don't want to make you uncomfortable at all. Good. Alright. Good. Do you find that this light here irritates you at all? Just trying to get different angles of your eyes. Can you go ahead and look up for me? Look down to your toes. To your left. And to your right. Good. Alright. Don't see anything offhand that we need to be worried about. So now I'm just going to go ahead and use the light on its own. So, holding your head still, if you can just go ahead and follow this light as I move it across your vision. Hold your head still. Good. And here we go. Like your eyes are tracing just fine. You can track this way and track that way. Any sort of problem if I move it in a circular motion? No. Alright, good. And what about on this side for you? You notice anything? Does that make you dizzy at all? Good, that's just fine. I'm just going to get a tad bit closer to you. Look inside here. We have a beautiful eye colour, so good. You use any sort of eye drops or really anything? Been prescribed anything by another doctor to use around or in your eyes? Once again, just follow this light for me. Good. Alright, so same sort of thing. I'm going to use the end of this light and have you follow it as I move it around. Once again, keep your head nice and still. Just move with your eyes. Okay, so here we are. you let me know if anything causes you any sort of discomfort, dizziness. Good. Alright. Okay. And if I move this a little faster, you able to track that? Looks like. And up and down. Good. Good. So, looks like you're perfectly fine on that front. I am just gonna have you read a basic eye chart. I know you said you don't wear any sort of lenses, but just to be on the safe side, I have this little baby eye chart here. So, this is just a normal distance. I can, of course, do further distance if we notice any sort of trouble, but I don't think that's the case with you. So, what is the lowest line that you can read on this eye chart? F, L, C, T, B. Wonderful. Now, can you go ahead and cover up your right eye? And can you read this line right here? Good. Alright, now cover up your left eye. Gonna have you read. Let's do this right here. Can you see that? Okay, easy. What about the bottom line? Can you see that one? And just to make sure, if I step back here, what is the lowest line you can read with both eyes? Good. Alright, perfect. Go ahead and make notes of that eye exam for you. Alright, so how's it going? Yes, they're very sweet. I'm going to go ahead and do your ear exam on my own. Yes. They can observe, but I'm just going to go ahead and do this portion of the exam. Do you wear any sort of hearing aids or anything like that? Okay, good. Any problems hearing people speak in a noisy environment? And do you listen to music very loud, anything like that? Okay, so I popped on some gloves here, and I'm going to start by just feeling your ears. None of this should cause you any sort of discomfort, so please let me know if anything feels a little weird or anything. And I'm just going to touch and kind of cup around your ears there. Just as a starting point, we're also going to test a little bit of sound, and if you're able to recognize some words, things of that nature, okay? Good. So, just to start, I'm going to go ahead and touch your ears now, okay? So, let's go ahead. Lean in a little bit, side to side as I kind of hold your ears. Good. No sort of discomfort there. Good. Yeah, don't worry. They're over there taking notes, but not about you, just about my procedures and things of that nature, okay? Side tap along your ears, how does that feel? Does that feel okay? Good. Good. And if I kind of tug on your ears there, is that uncomfortable? any sort of excess earwax, discharge coming from your ear? Move to this side fully. Have a look in your ear. Just grab that light. Good. Just gonna use this light here to look inside your ear a little bit, okay? Good. Looks nice and healthy. I don't see really anything that we should be worried about. Okay, I'm going to do the same thing on this side. Going to use the light to look inside and just kind of tap a little bit on your ear to make sure that everything is nice and comfortable for you. Okay. Good. I don't think that there's anything. Okay, so now I'm going to just do a little bit of sound testing. I'm going to rub my hands together like this, and we're just going to make sure that you can hear that on both sides, okay? So, if you would tell me which side I'm rubbing my fingers on, okay? Good. Can you tell me which ear I touch? And that rubbing motion again, which side do you hear it on? Good. Okay. Now tell me when you can't hear this anymore, okay? Okay. This side? Good. And is it about the same on both sides, would you say? Do you have any sort of problem hearing it from the front? About the same? And what about from behind you? Any sort of problem hearing that? Good. Good. Alright. Now I'm going to go ahead and say a couple words into your ears. And if you can just repeat them. I'm also going to be cupping the ears off and on just to get a full view of what we're looking at for your hearing when it comes to words, okay? Okay, so I'm just gonna step to this side here. Penguin. Good. Giraffe. Good. Relaxation. Okay, good. Tingles. Okay, now I'm gonna go ahead, kind of cup. Sleep. You still hear that? Good. Okay, what about this side here? Dreams. You hear that okay? Good. Gemstone. Okay. Coffee. Good. Okay, let me just feel a little bit more here. This side here. Okay. And then just a little bit more ear cupping for us. Closed. Open. Closed. Open. Good. Good. I don't think we have any problems with your hearing either. Yeah, you're looking out to be very, very healthy for us. So, easy patient for sure. Alright, now that your ear exam is pretty much done, I'm gonna switch on over again. You doing alright? Perfect. We really do appreciate you allowing the med students to just kind of get a feel for how all these exams go down, okay? Okay. Alright, so next up I'm going to be examining your scalp. Kind of goes along with the face examination that I had just performed, but I want to get a feeling for your hair texture, your scalp, just to make sure that it looks nice and healthy. Right. To experience any sort of dryness or itchiness along your scalp. Alright. Wonderful. So I once again have my gloves on for you, so I'm just going to look a little bit along your head, your scalp, also checking that you do not have any sort of bumps or anything that would cause us concern, alright? Okay, so just going to be looking along your scalp, just kind of using my fingers here to part the hair and have a good look at your head here. Not to worry, you have a lovely shaped head. Don't be self-conscious about such a thing. Okay. Good. I'm just going to step to the side of you. Right. Good. Perfect. Well, I must say, your scalp looks incredibly well, considering we are into the winter months, of course. So, same thing on this side, just having a look. See. Perfect. And I'm just going to just up on my tippy toes a little to fully look. Good. You alright? It's like a free head massage with your annual checkup, if you will. Alright, I'm just going to work along the back of your head and your scalp here, just to feel, make sure we aren't missing anything, of course. Lovely. Alright, so that looks nice and healthy. Very healthy patient for us today. We appreciate that. Do you have any sort of questions for me regarding your head, your hair, or your scalp? Of course. If you do sort to notice a dryness or an itchiness along your head, your scalp, even down onto your forehead, could be relating to the weather, of course. The colder months are harsh on all of our skin, but I would also pay close attention to some of the products that you're using. Yes, if you switch into something and then you notice such an effect, you could be allergic to something within that product, or your skin just might not agree with it. Alright? Wonderful. Moving right along in your exam. Alright, so your last little section here with me is going to be testing some of your strength. Just to make sure that your muscles are working how they should with your arms and your legs. Do you have any sort of discomfort, any sort of pain, numbness? Alright. So, just to start, I'm going to have you lift up your left arm right here. Just lift it. And I'm going to apply a little bit of pressure. And you're going to resist that pressure. Alright? Good. So, once again, just go ahead and lift up this left arm here. Okay. As high as you can go and press against my palm here. Good. Good. Alright. So, do the same, but instead of out, gonna use your forearm here and press forward for me. Once again, I'm gonna apply some pressure. And you just resist that. Right. 1, 2, 3. Good. Alright. Wonderful. Go ahead and make a fist for me. And I'm going to try and open up your hand so that I can see your palm. And you just resist me. Good. So make that fist. And 1, 2, 3. Good. I'm going to do the same thing on your right arm. So first up, lift your arm straight up, and I'm going to apply that pressure. 1, 2, 3. Good. Alright. And then forward. 1, 2, 3. Good. Nice and strong. And then go ahead and make that fist. I'm going to try to open up and see your palm again. Okay? So 1, 2, 3. Good. Good. Now, do you have any problems or pain in your fingers, your wrists, any sort? Yes, we are the generation that uses our fingers for texting and typing quite often, so we need to look at these things a little earlier than we have in the past decades. Alright, so I also want to go ahead and test your legs. Now, you can stay sitting for this, that's perfectly fine. Now, you're just gonna, once again, take your left leg and stick it out. And I'm going to try and push your leg back down. Alright? So let's start with the left side again. Just go ahead and stick that leg out. And I'm going to push. Good. Good. Let's do that with the right side as well. Just lift that leg up. Good. Good. Alright, perfect. Just rest your legs back. I'm just going to go ahead and test your reflexes on your knees. So just let your knees hang. I'm just going to tap your knees. Alright, and make sure that we see that reaction that we want to see, okay? So 1, 2, 3. 1, 2, 3. Good. Good. I think that's just fine. Perfect. Wonderful. Now, do you notice any sort of issues with your neck? Just because we are testing a little bit of the strength, and we tested your arms, but I want to make sure that your shoulders and your neck are nice and strong too. Wonderful. So if you could tip your head to the left side for me, and I'm gonna try and push it back. Okay? So go ahead and tip your head. Good. Now tip your head to the right side. And press. Good. Nice and strong there too. Alright. Wonderful. I think you're nice and strong, no sort of muscle issues or numbness that we should be concerned about. Alright, go ahead and add those details to your file. Yeah, you're almost done. Not too bad, right? Cool. Alright, go ahead and add those. Alright, so it looks as if the last portion of your exam today is going to do with your nose. Yes, we're going to just look and see if you can accurately describe what scent we are having you smell. Have you done this sort of test before? Nope, that's perfectly fine. It's really simple. So I have a few bottles here that I'm just going to open and sort of wave under your nose. Take a nice deep breath, and if you can just identify for me what exactly that scent is. Lovely. So our first one, just going to wave it under your nose. And what does that smell like? Vanilla. Lovely. And then this one here. Once again, just going to move it under your nose. What does that smell like? Coffee. Yes, lovely. And another. Let's do this one. Can you go ahead and identify what that scent is? Lavender. Yes, so very calming. And one more, one last smell. What does that smell like? Peppermint, yes, lovely scents, right? Nothing too scary of any sort. Alright, so go ahead and mark that in your chart that you passed that test with flying colours. Thank you again for allowing me to be part of this examination for you today at the Calming Clinic. Wonderful. I do believe that Dr.CalmingEscape has a few more things to go over with you, and then you will be free to go. Alright, of course. Thank you so much. Alright, so it looks as if your exam is done. You look 100% healthy. There is no cause for concern. There isn't really a reason for us to run any sort of labs unless you are specifically experiencing a symptom. Perfect. So because this was just a general checkup, you are all set and have a clean bill of health. Of course, you can come back and see us if you get sick or you start to have any sort of other symptoms, but for now, we are saying that you are tip-top shape. Yeah. Perfect. Well, once again, thank you so much for coming in to the Calming Clinic. Thank you for allowing these students to work with me today on your exam. We really do appreciate it. Alright. Thank you so much, and have a wonderful day. Bye now.